Hello everybody, so we are from SGD B2. Today we are going to expand our student project about conduct disorder. Next, these are our members. Next, chapter 1 introduction. Next, uh, the first one is background. So aggressive behavior. Aggression behavior is aimed at injuring or harming other living things, such as hitting, slapping, kicking, and so on. As they get older, most children tend to learn how to inhibit this aggressive behavior. But when they fail, they may experience some behavior disorder, such as conduct disorder. Conduct disorder is a psychiatric disorder that usually emerges in childhood or adolescence and characterized by severe antisocial and aggressive behavior. Next. Conduct disorder frequently occurs with ADHD and often leads to antisocial personality disorder in adulthood. Next.
So the worldwide prevalence in children that are diagnosed with conduct disorder is 2 to 2.5%, with the prevalence in boys is 3 to 4%, and the prevalence in girls is 1 to 2%. Next. So the next one, I will explain about the objectives of our research. So the first one is, what is conduct disorder? What are the types, the symptoms, the causes, and the risk factors? How to diagnose conduct disorder? What is the treatment? How to prevent conduct disorder? What are the differential diagnoses? And what are the current research of conduct disorder? Next. So the benefits of our research is, the first one is to understand about conduct disorder in general, to understand about the types, the symptoms, the causes, and the risk factors of conduct disorder, to understand how to diagnose conduct disorder, to understand about the treatment, prevention, differential diagnosis, and to increase our knowledge about the current research of conduct disorder.
Chapter 2 is content. Next. The first one is definition. According to DSM-5, conduct disorder is a repetitive and persistent behavior that involves aggression against people or animals, like bullying others. The second one is destruction of property, like breaking someone else's house or car. The third one is fraud or theft, like criminal acts and harassment. The fourth one is serious violation of rules. Next. DSM-5 divides conduct disorder according to onset. The first one is childhood onset subtype, which is the presence of one criterion before the age of 10 years. And the second one is adolescence onset subtype, which is the absence of any criterion before the age of 10 years. Next.
First is conduct disorder with common family tags. Its first is dissocial or aggressive behavior, almost entirely confined to the home and interaction with family members or immediate households. Second is unsocialized conduct disorder. It's characterized by dissocial and aggressive behavior and happen repeatedly with individual relationship with other children or adolescents. Third is socialist conduct disorder. It's characterized by dissocial and aggressive behavior that happen repeatedly and occurs in individuals who are generally integrated with their peer group. Fourth is oppositional deviant disorder. It's characterized by markedly deviant, disobedient, disruptive behavior, but there are no serious dissocial and aggressive acts that violate the law or violate human rights. Fifth is under conduct disorder. It's characterized by criteria that do not match one of subtypes of conduct disorder. And the sixth is unspecified conduct disorder. Met the criteria for general conductive disorder, but didn't meet one of other subtypes. Next, based on onset in DSM-5, there are three of conductive disorder. First is childhood onset, appears before 10 years old, typically found in males. In this type, antisocial behavior is higher than another child. And the second is adolescent onset, appears when the patient is entering adolescence. The adolescents show less aggressive behavior, but they usually show more normal peer relationship than childhood onset type. And the third is unspecified onset. On this type, the onset is not specifically known. This type can happen because because the patient was not aware when the symptoms appear. Thank you.
Okay, next is about the symptoms. So, conduct disorder has been known to develop earlier in boys than girls, which would present at the age of 10 until 12 years old in boys, whereas 14 until 16 in girls. Due to the fifth edition of the Diagnostic and Statistical Manual of Mental Disorder or DSM-5, a person with this kind of disorder will show some manifestation of behavior. The criteria is actually largely unchanged with the SM4. Symptoms that are divided into four main groups, which are aggression to people and animals, destruction of property, deceitfulness, and also serious violations in rules. Those symptoms also must be significant impairment in academic or social living to be diagnosed with conduct disorder. Thank you.
Cause and risk factors of conduct disorder. Conduct disorder can be caused by a complex interaction of psychosocial and biological factors. Environmental factors such as children from disadvantaged, dysfunctional, or disorganized homes with the exposure of domestic violence, harsh parenting, and/or childhood neglect may lead the child into developing conduct disorder. Other environmental factors comes from social environment such as a large classroom size in school, lack of positive feedback from teachers, rejection or isolation from peer delinquency, and even exposure to neighborhood violence may also cause the children to develop conduct disorder. Next. Risk factor of conduct disorder are ADHD, mood or anxiety disorder, substance abuse, PTSD, learning and developmental problem, and children whose parents have mental health problems. Children with these factors may be easier to develop conduct disorder. Next. Biological or neurological findings of conduct disorder shows that low level of dopamine beta hydroxylase, low level of 5-hydroxy indole acetic acid, and high testosterone might contribute to the aggressive behavior in children with conduct disorder. There is also a correlation between resting frontal brain electrical activity and aggression. Next. Neuropsychological insults can cause an early life deficit in language, memory, and executive functioning, developmental delays, which can lead to poor social skill and other disability. And finally, head injuries can cause neurological damage and can support the development of conduct disorder in children. Next.
For diagnosis method of conduct disorder in DSM-5, there are 3 points that need to be observed for diagnosis. Point A, there's a repetitive and persistent pattern of behavior that violated the age-appropriate societal norms and rules. There's a presence of at least 3 of the following 15 criteria in the past 12 months from any categories, with at least 1 criterion that present in the past 6 months. Point B, there's a disturbance in behavior that causes clinically significant impairment in social, academic, or occupational functioning. Point C, if the individual is aged 18 years or older, criteria are not met for antisocial personality disorder. Also, we have to specify the onset type, presence of LPE, such as lack of guilt, lack of empathy, and concern about performance and shallow. Also, we have to specify the current severity from mild, moderate to severe. Next. These are the 15 criteria on point A earlier. They divided into 4 categories, which are aggression to people and animals, destruction of property, deceitfulness or theft, and serious violation of rules. Once again, there must be a present at least 3 criteria in the past 12 months and at least 1 criterion in the past 6 months. Next.
Okay, some of the most common differential diagnoses for this disorder are attention deficit hyperactivity disorder and oppositional defiant disorder or ODD. Oppositional defiant disorder and conduct disorder are a common adolescent disorder, and these disorders include behaviors that can cause negative impact on society, family, and even themselves. The main characteristics of ODD are repetitive negative behaviors that execute and doesn't obey rules. These characteristics that distinguish between oppositional defiant disorders and conduct disorders. Conduct disorders is also associated with attention deficit hyperactivity disorder. ADHD is a condition where the patient is hyperactive, has difficulty in concentrating, and is distracted. This characteristic can differentiate between conduct disorders. Some other disorders that are also associated with conduct disorders are substance abuse and mood disorders. However, mood disorders have other characteristics that can differentiate one of them, such as the symptoms of depression. Thank you. Next.
Treatment options for conduct disorder are behavior modification, family therapy, and pharmacotherapy, or often combination of 3. The first one is cognitive behavior therapy. This program focuses on children learn how to express and control anger in more appropriate way. This therapy reshapes child's thinking or cognition, thereby improving problem solving, communication, moral reasoning skill, impulsive control, and handle stress well. Family therapy or parent management training. Based on research, conduct disorder are the result of maladaptive parent-child interaction. So, this intervention to improve parental behavior management skill.
how to understand emotion and respond to children, and the quality of parent-child relationship with good communication. Next one is peer group therapy. This therapy to improve social and interpersonal skills such as better behavior towards people around him. Next, pharmacotherapy. There is no drug approved by the U.S. Food and Drug Administration or FDA for treatment of conduct disorder. Some medications are used to treat symptoms such as impulsivity, aggregation, mood swings, and other mental illness that may be present, such as ADHD or major depression. According to Canada guidelines, there are some drugs used to conduct disorder are psychostimulants such as methylphenidate or amphetamine, atomoxetine or Strattera, guanfacine, clonidine, risperidone or risperdal, quetiapine or seroquel, haloperidol, valproate or depacon, and lithium. Next.
As experts are still unable to answer what the exact cause of conduct disorder, it is safe to say that the most effective way of preventing conduct disorder is by eliminating the risk factors. Eliminating the risk factors mainly involve positive parental roles in immersed long-span intervention programs. These intervention programs combine all of children's most important environments, their homes and their schools. One example of these types of intervention programs is the Fast Track project by Duke University. It spans for 10 years, starting from the first grade and ending at the 10th grade. It is divided into two stages, the elementary and the adolescent stage. The elementary phase has 6 standard interventions, which 5 mostly done at school, while the adolescent phase also puts individualized intervention in focus alongside the standard interventions. Other school-based prevention programs provide evidence that the interventions will help prevent conduct disorder, careless unemotional trait, and impulsivity in the long run. Thank you.
Next, we will talk about the current research of conduct disorders. So, first, it is kind of underrated disorders. It is one of the least widely recognized or studied psychiatric disorders and funding for research into it. Then, conduct disorder itself associated with health and personal burden 7 times greater than attention or hyperactivity disorder or ADHD. And conduct disorder is also associated with a greater health burden than autism. Then the problem caused by untreated conduct disorders can ruin children's future, such as people with conduct disorders are more likely to have children earlier, become unplanned pregnancies, to become dependent on benefits, homeless, or even to attempt suicide. Next will be continued by my friend.
So conduct disorder is often caused by a decrease in quality of someone's life, and this degradation of life will later on have the correlation with the presence of ADHD, ODD, and the substance use disorder in terms of comorbidities. So around 16% up to 20% of youth with conduct disorder have comorbid ADHD, and although more than half of the patients with a conduct disorder claim to have never been diagnosed with ODD before, in fact, there are about 60% of them who met the full criteria for ODD. And adolescents who suffer from conduct disorder, antisocial personality disorder in them also develops in 45 up to 70%. And also, conduct disorder has also the correlation with the failure to complete high school, drug use, and criminal behavior. In the case of adults, conduct disorder is often associated with other psychiatric disorder in the hospital, such as alcohol use disorder and then drug use disorder.
Next. Conduct disorder is one of the psychiatric disorders which is commonly found in childhood or adolescence. It is characterized by severe antisocial and aggressive behavior. Based on ICD-10 and DSM, conduct disorder can be classified into several types. Symptoms of conduct disorder can be divided into 4 main groups: aggression, vandalism or destruction of property, deceitfulness, and violation of set rules. Diminishing concern on well-being and feelings of others are observed as well. There is a complex interaction between psychosocial and biological factors. Social factors such as rejection, violence, and peer delinquency also contribute to the development of this disorder. Biologically, studies found that low levels of dopamine beta hydroxylase and indole acetic acid, as well as high levels of testosterone, correlated with the aggression of conduct disorder. Thank you. Next.
In diagnosing patients with conduct disorder, we can use parameters such as DSM-5, and furthermore, in this, conduct disorder will be categorized by the kinds of progression, time of the onset, people with LPE, and severity level of the disorder. Hence, several assessments observing the disorder should be done. Treatments for CD patients, including psychotherapy such as CBT and peer group therapy, and pharmacotherapy such as psychostimulants like methylphenidate to treat symptoms, atomoxetine, guanfacine, and clonidine. Because the exact cause of conduct disorder is still unknown, we can prevent children from getting conduct disorder by reducing the risk factors with improving their relationship with family, especially parents and friends. Next. The differential diagnoses for conduct behavior are commonly attention deficit hyperactivity disorder or ADHD and oppositional defiant disorder or ODD. And there is still a lack of resources regarding the study of conduct disorder, but current researches show that possible negative outcomes such as becoming an antisocial person, borderline personality, criminal behavior, tobacco, and alcohol addict could happen in the future if the conduct disorder is not treated properly. It is also stated that conduct disorder has an association with ODD and ADHD. Next. Alright, that's all from us. Thank you for your attention.